Wow, great to see all of you here. Good afternoon, good morning, good evening, wherever you are joining us from. Amazing time. Trust me, just sit back and enjoy this meal. It's very, very delicious. Well, today, why are we here today? To discuss on improving research capacity in perioperative nursing. We want to especially appreciate the host, Transformational Dialogue Coalition. This is a broad coalition of organizations and individual meeting, discuss and take action. And one of the actions they've taken is this event. And we say Twali, like the Africans will say. Thank you so much, Transformational Dialogue, for having us. This group will be meeting next week to follow up on today's discussion, and we shall share details on how to join this meeting before the end of today's meeting. Once again, thank you and welcome. My name is Lawal-Aiyedun. I'm from Nigeria, a nurse leader, and of course, I happen to play the role as a member of board of GIGS, Global Initiative for Children Surgery. And I want to say that I'm excited because, of course, nursing has been part of me for the past 25 years. And I will say that before I will allow my distinguished discussant, the panelists, I just want to give some housekeeping information. It is interesting to know that we have interpretation of this meeting in different languages today. So you can just look at the bottom parts of your computer and click on the preferred language you will want this discussion to reach you, either in French, Portuguese, Spanish, English. And that is to say that, yes, this is a global event. And once again, we say thank you to our host. This section will seek to identify the main barrier to perioperative nursing from participating in research and suggest way forward. We all know how important research is. Without research, we cannot move forward. It's actually the pillar of any intervention, especially perioperative care, particularly discussing about nursing perioperative care. And all our participants today, we really appreciate you. You will also have time to contribute because this is going to be an interactive section. So you have time to contribute. You can also use the chat room to connect with us. And of course, if you want to contribute verbally, you can also raise up your hand, we'll recognize you. Perhaps you are not speaking. Kindly mute your mic. And straight on, without wasting much of our time, I want to ask our distinguished panelists, our colleagues all over the world. Trust me, we have hybrid of nursing leaders here today, and you'll be hearing from them soon. So I want to call on Gilles to please introduce himself. Over to you, darling.
Hi, everybody. My name is Gilles Eloi Rwibuka from Burundi. I'm a nurse anesthetist. I'm the current chair of the Nurse Association of Anesthetists, ACHAPS, and we are involved with the IFNA, the International Federation of Nurse Anesthetists, representing Burundi. And we are also representing Burundi in the WFSA, the World Federation of Societies of Anesthesiologists, as a corresponding member. Personally, I am actually a doctoral candidate in critical care and emergency nursing, and I've been also involved with Lifebox since 5 to 6 years with projects in Burundi to improve quality of care of patients in safety of surgery. This is my brief introduction. Thank you.
Thank you so much. It's so exciting to have you. Quickly, we call on Larissa to introduce herself. Briefly, please.
Hello, everyone. Meu nome é Larissa, My name is Larissa. I am a nurse. I work with perioperative care for 15 years here in Brazil, and nowadays I am a nurse chief in a general hospital. I'm part of a society of surgery center of nurses in Brazil, and I've been working a lot to be able to bring the best nurse care to all of the places of our country. We have a country that is very diversified, and the access is a great challenge. So this is the main themes and mottos, and that's what I've been trying to work here internally on my daily life and with my society.
Thank you so much, Larissa. Over to you, Austin.
Many thanks. Greetings and welcome to this discussion. I'm very much excited to be part of this discussion. So I'm Augustine Ndaimani. I am an assistant professor at the Center for Nursing and Midwifery at the University of Global Health Equity. So this one is a university which is based in Rwanda, but with a global focus, meaning that we get students from across the globe. And our mission actually is to improve equity, which means we want to take the best services to the most vulnerable or the poor communities, notably rural areas. So at the same time, we also want to increase the nursing voice. So in terms of nursing leadership and also other nursing specialties, including perioperative nursing, we try to improve their capacity. And I'm also somebody who has been exposed to a lot of researches. I've published quite a number of papers, and I also peer review journal manuscripts. And at the same time, I'm also sitting in the IRB board at the university. Thank you.
Thank you so much, Austin. You know, when you allow the lecturers to go on, they can go on and on and on again. Thank you so much. We are glad that you can make it. Now, quickly, I want to call on my teacher and my friend, Professor Vinitha, to go ahead and share a few information about yourself.
Hello, Punni. Thank you for the opportunity. I am Vinitha Ravindran. I work as a professor in College of Nursing, Christian Medical College, Vellore, which is in India. I've been teaching for the past 30 years. And I'm also a nurse manager in the pediatric surgery and pediatric isolation unit in the hospital side. I teach research. I teach nursing education and pediatric nursing for my students, both undergraduate and postgraduates mainly in my college. And I'm glad to be here. Thank you.
Thank you so much. And once again, I want to welcome you all for this wonderful section. Yes, I think it's an opportunity for us to really share more light on what we do as global nurses, and of course, particularly barriers that keep nurses away or limits our involvement in research in perioperative nursing space. And right now, I want to recognize all the partners and the coalition of transformational dialogue. Thank you. We can't actually thank you enough. So right now, we are going to go straight to the business of the day. And I want to just inform our panelists that you have 4 minutes each to discuss this. And first of all, we want to know, friends and colleagues want to know, how did you get involved in research? And are there barriers along the line? What hinders nurses generally involvement in nursing research? And I will start with my friend, Austin. Please go ahead, Austin.
Many thanks, especially on telling us about the 4-minute, cutoff. So I'll try to summarize my involvement in research. So actually, I became a nurse in 2005. And actually, people who learned around that time would agree with me that it was before these millennials who are actually having information at their fingertips. we did our research. That is our final year research. Using literature which were to actually handpick from the library. So there were no databases and stuff. So it was actually an exciting step in the research process. So I would like to believe that that's when I got interested in research because actually the mentored process was quite thorough. In that we actually acquired a lot of skills to do that research, from the design of the research itself to data collection and also preparing the report. So I would like to believe that that was when I got introduced to the research. But then when I became a nurse, a clinical nurse, I actually discovered, we were taught at school that a nurse is a counselor, is a teacher, is a case manager, is an advocate, is a change agent, or is also a researcher. But then I discovered that to function properly in these roles as a nurse, you need to keep researching. So it means the moment I became a nurse, I actually continued with my research. But then for me to produce something which is quite tangible, because in research, for us to know that somebody is doing research, we need to see publications, we need to see their attendance at conferences, or some posters which they will be doing, and also maybe grants, grant application, and also maybe them getting funding. So I would like to believe that my master's was a period of mastering that research capability. But then it was only when I was now doing my PhD that I managed to do a research which could employ other people, which I was a PI and could control from start to finish. And fortunately, I was mentored. So because of capacity, we had North-South mentorship. So I had some mentors from Norway, across from Malawi, from Zambia, and also from Zimbabwe. So I had a lot of that mentorship. So that's when I actually got to do my own research. And actually that opened the doors for me, because, when you get to a conference, you actually expand your network. So I then began to get some fellowships, some small grants, and also some opportunities for collaboration with other researchers from across the globe. So some fellowships which I think actually improved my research capabilities included the DHS. Actually, they offer the demographic and health survey. They offer a detailed course in research, from data analysis all the way to scientific publication. But I think you agree with me that for somebody to publish,
thank you so much.
Actually, this will be.
Thank you, Austin. I'll get back to you soon. But right now, let's quickly move to Professor Vinitha. Will you want to share with us how you get involved in research, and of course, what are the barriers you face along the line? Over to you, Professor Vinitha. Thank you.
Thank you, Bunny. I got involved, I should say, initially in my undergraduate and the master's program. Research we learn and we do because it's part of your educational requirement. So that's how I looked at it, and I started with research. But then what really made me interested in research was the evidence-based practice that was talked about so much in the late 90s and the early 20s. So when that came about, whenever they asked questions about what is the basis of evidence for what you're doing, then I realized it's important that we read more about what are the researches that have been done. And also, to create evidence, you also need to ask certain questions in the clinical area. And that's actually what motivated me to be interested in research. Until then, it was just a necessity or a course that I had to finish. Once I started asking questions in the clinical area, especially in my own area, it became very interesting because you wanted to find answers by doing research. And that's how I started. What are the barriers? the most important barrier is that you are so grounded in your care. You're so much involved in patient care. You don't want to really think about doing research. One thing is we don't have time as practitioners or teachers. Another thing is you just are really so overwhelmed by your clinical work that you that I found it difficult to allot time for research. So I always thought, research is to be done by somebody else, and I'll use whatever you're saying, I'll just do in my practice. So time and my involvement in the clinical area or in teaching, and there was no demand at that particular time for research as such in our work. The clinical work was given much importance, and the research was not given that much of importance, even in my academic position. That was in my earlier years, I'm saying. So there was no demand, so nobody asked me to do research, and I also was not allotting enough time. These were my barriers: time and your involvement in one type of work that you don't want to get involved in other, and the expectation of you as a need for being a researcher. These three reasons were my barriers. Thank you. Over to you.
Thank you so much, Professor Vinitha. I agree with you absolutely that in clinical area, we focus so much on our clinical services and pay less attention to research. Over to you, Larissa. Can we hear your story? Thank you.
First of all, I would like to say that I would like to be able to communicate in English. I've been training a lot for this. I expect to be able to share my experience with you without interpretation. My experience in research, there's a lot with my assistants. I'm a nurse of assistance that came from the daily life. And I started questioning myself why some practices we had on our daily life couldn't be proved, which sometimes we see norms and policies developed in places that sometimes don't make any sense for the ones who's on the daily life of the assistant. So I understood that I had to use the research as a way to validate what was being done. Brazil is a country with a lot of realities, and this is like this in the whole world. And many times what we understand and define in some countries which are an economic situation different from ours, is hard to apply in our practice, but that doesn't mean that we make practice that are worse or not safe. On the other hand, it's in the diversity that many practices are built. So I am working in my life with this proposal to validate and say that it's possible to have a healthcare safe without all the possibilities of resources, of technological resources, because the care many times it's human. And this is what we need to take, what's beyond technology. It's what I believe. In Brazil, we have a program of financing, which is how I could do my degree and then my master's and my research within a public university where I didn't have to pay, and that helped me a lot because in fact opened doors so I could get into the research world. My greatest challenges because I had to work as many nurses, and I believe that this is a world matter because people need to work to support themselves and to spend time to study as well. So this is a great challenge and requires a lot of will to be able to dedicate ourselves to our work and to take our work to research as well. This is a lot of what I believe and what I've been trying to make it possible. and to show the nursing science. Nursing is much more than an activity or a professional, a secondary professional. Is the main character in the care in many places. It's not different when we see the surgery care, and we need these professionals, which is the majority of the health professionals that make the difference. And I believe not only in Brazil, but in the world.
Wow, what an interesting experiences. Thank you so much. And right now I'm going to call on someone who is dear to my heart, my friend, to please share your thoughts on this and your journey so far. Gilles, please take the shots.
Yes, thank you. As the previous panelists have stated, I was introduced to research while I was still a student, because at the end of the program in undergraduates, we have to make a report, which included research. But before doing that, we're facing with problems for getting resources while we're students. So, and also while we're training, sometimes we had to adjust to one supervisor or one mentor according to each case. I'm talking about nurse anesthesia. So it was very, very difficult to be adjusting each and every time to each mentor for each case. So this sparked it me like a curiosity to see how can I reach like an evidence-based level to know what is real and what is true. So in this reasoning, we reached the point to create the nurse association that I'm representing currently. So in this part, first I had a curiosity concerning data and research, but with the association I'm representing, while we were running projects, we faced a major problem when some of the projects we wanted to implement needed a baseline data. For instance, one project I remember we were about to implement with Lifebox required nationwide data, but it was impossible to have those data. So we have to carry them ourselves. So this one example. And with my graduate studies also, I was involved with research. But the main barrier that I'm going to say is the lack of interest from the nurses themselves, which has a deeper root source, which I'm going to explain maybe in the future intervention. Thank you.
Wow, thank you so much. Thank you for sharing that. One thing that really stood out for me is the fact that yes, as nurses, we are involved in one form of research or the other, but it's quite pronounced when we have our masters and move on in our careers. Thank you so much. And I want to also say thank you to all our friends, colleagues, our hosts for staying with us. Thank you. We really, really appreciate you. Thank you. And I'm seeing amazing, amazing leaders on the line. Thank you. We cannot stop appreciating you. So the next round of questions will take us 3 minutes each. And I really want to encourage us to pay attention to the timeline. And I'm going to go first to speak to Larissa to please share with us, what do you think, in your own opinion, the measures society, NGOs, association, what can they put in place to build research skills for their members? You know, having listened to all experiences that we've shared, what are the measures that the organization can actually put in place, either at the clinical level or at the institutional level? Please go ahead, Larissa. Thank you.
I believe that there are many possibilities that we develop the research in healthcare. These initiatives, in my view, they don't need to depend only in the society, but also in the reality that we work at. Nowadays, there's a it's hard, at least in Brazil, that hospitals, institutions promote these spaces of research. we depend a lot on these organizations still. Now, on this last year, I could be part of the biggest association of nurses in Brazil, which is very strong. And since then, we've been trying to create spaces so that nurses can promote research spaces. Once a year, we have a congress, an event, a meeting, a national one, so the nurses can exchange experiences, bring scientific content, and also scientific space so the nurses can present their work. And this is a simple initiative, but it gives a lot of results. You can see the example of today. We're all here from everywhere in the world, but sharing from the same pain. And this makes our objective stronger. So I can see as well that we need as organization to insist more the support of private initiative that could create spaces for research in health care. So the nurses are the main kind of character of the care. We need this visibility not only in the inside the public institution, support from government, but many others, communities that can in fact contribute for the transformation of the healthcare. So I believe in this, and I've been trying within my association to work a bit. We're going to release now during the Congress this year a line that is called social, which is a space in the community that to bring to the society a free surgery for the people who practice it, because the safety of the patient has to be good. That's what I believe, and it's something that I bring as my main objective in life. For people that do the surgery fall in love as much as us that research and study and believing that it's a challenge, but it needs incentives, needs sponsorship, so that gets there. In a country so diversified like that, in a world so diversified as ours, is a priority to make the care is safe for
Thank you.
everyone.
Oh, wow. Yes, to really make the care safe for everyone, we need research, evidence-based practice. Thank you so much, friends and colleagues. This is still Transformational Dialogue event, improving research capacity in perioperative nursing care. Right now, I want to move quickly to Gilles. Please, what can you add to what Larissa have said so far?
So thank you. What I can add is I'm going to take this on multiple layers. First, I'm going to start with nurses themselves. Taking in local context, we need to have national organization for professional nurses to join the national, regional, and international organizations such as IC and other diversified health organizations, such as, for instance, for us, we are joining the IFNA, as I stated. This will help us to have updated standards, which include aspects for research. This one. Number two, the hospitals themselves, if they implement projects for quality improvement towards evidence-based practice, this will hinder the curiosity into doing research. Third point, universities and the libraries, sometimes the library facilities are lacking facilitating into doing research. The fourth point is at governmental level, where the hierarchy within the healthcare system, everything which is done is based on research and improving quality and capacity of nurses. So this, as a synergetic approach, will improve the quality of research overall. So this is my 4 points that I can say that can improve the quality of research, starting from nurses up to the governmental level.
Thank you so much. Well said. Quickly, I want to call on Austin. What about the training institution? Are there simple measures that can be put in place to improve the nurses' participation in research? What are the opportunities that we have? Over to you, Austin.
Yeah, it's fine. Many thanks. So actually, training institutions are well placed because already they have resources, the libraries, the software, which is actually important in doing research, and also the mentors. Usually that's where we have the professors or academics who have a lot of experience in research. So as institutions who are well capacitated, I would like to believe that the universities now need to reach out to the nurses in the clinical area, like a paradigm shift to involve them in research activities, because sometimes it's like the fear of the unknown that may actually stall progress in nursing research. Because I would like to believe that for those who have submitted papers in journals, they know sometimes you need to have a thick skin, you need to be really brave in order to publish or in order to apply for a grant. So we need that collaboration with the clinical area, and also maybe to do some coaching clinics. I've seen some MOOCs, but most of those have been done by WHO, TDR, massive open online courses in collaboration with their universities, in some coaching clinics for the nurses in the clinical area. So I think those are some of the things which can be done from training institutions. But I believe that nurses as individuals also need to be motivated intrinsically to do the research because it needs that motivation. Yeah, so and we need to ensure that facilities give time. The hospitals give time to nurses. Actually, there's a lot of time which is given for other nursing activities, but nothing for research. So, after knocking off at maybe 4 o'clock or whatever time, usually they go home and no more time is given for that. So they need that protected time and also recognition that at least if they do research, maybe they can be a focal person for research, or maybe a focal person for clinical audits or something which is a research focus as an incentive. And I was also thinking of these CPD points. I think Nurses Council can also, there are some which are already doing that, at least to incentivize the nurses, then they who publish, then they get some CPD points. It's also a very strong plea to NGOs. I think we need to have more of these dedicated funds or grants, small grants, even $2,000, to just encourage the nurses to do the research. I was looking on the the journal author name estimator, and I only saw about 17 journals for perioperative nursing. So which means we need a lot of journals out there so that, nurses can have a voice. Thank you.
Thank you so much. Amazing comments. Thank you. We really need the collaboration. Trust me. Over to you, Professor Vinitha. What further comments can you add to what Austin has just said?
Maybe before I can just mention about some of the possibilities for nurses, apart from the difficulties or challenges that I mentioned that I faced, some of the other challenges that nurses and nursing students face nowadays in terms of research, I'd like to list a few which will help us to sort of focus our future interventions to empower nurses in research. Few of the things that comes as challenges, the nurses or even some of the nursing students do not have expertise in doing research because they have not had adequate training or teaching or learning in the research methodology as such, and how to put forward or go forward with a proposal. That's one of the challenges that we have. And we also see that in many of our countries, there are not enough mentors for the nurses, even if they are interested and if they want to do research, they don't have adequate mentors to do that or help them with improving or facilitating their expertise, knowing how to do research and sort of guide them through the research process. So that's another challenge. And there are no resources, like all the other panelists mentioned, in terms of finances, in terms of clinical facilities available. In my country, in many of the institutions that are like for nurses, nursing colleges, if the nursing students want to do research, they don't have a supporting clinical area. They have to get permission to go enter into clinical area. In my hospital, it is not so. Like I mentioned, I am a faculty in the College of Nursing, and I have a dual role in the hospital as well. So I go to my clinic, that's my clinical area. Pediatric surgery department or the unit is my area as well. So I have the freedom to teach research and also guide my students in my area if I want to. That's a very wonderful opportunity, which may not be available for everyone. So they cannot do, many of them are not unable to do clinically based research. That's another challenge that they face. So no funding, no facility or clinical area where they can do without any problem to do research. These are some of the challenges that nurses face. And how do, as a training institution, especially as a teacher, how do I, or how can we empower our own nursing students and our nurses who work in clinical area, in community, as well as in acute care areas? How do we do? I would like to share some of the things that we do in our own area. One of the things that we realized very early is the need for review on methodology courses. We have learned research methodology in our undergraduate and our post-graduation or our masters, but we forget, we don't use it. So we are now having the review courses on research methodology. So whoever is interested, any nurse who's interested in doing research can attend this, have a review of this research methodology. And our courses are about a week in duration. So sort of we help them to develop a proposal, an outline of a proposal. So they get to know what to do if they want to do or if they want to initiate research. Then the other important thing that we have is to encourage our own nurses in the clinical area to do research. And as a professor, I'm also in my own area, in my pediatric surgery unit. So I offer and encourage the nurses, the charge nurses who are in charge of the unit, and specialist nurses like pain nurses, ostomy nurses. These are nurses who are already doing excellent work. So I encourage them to ask questions, clinical questions, and ask questions that have worked, on interventions that have worked and not worked. So they're always motivated to do. So we encourage them to ask such questions, and we help them. We work together to develop a proposal. A very simple proposal might be, and to do research. That's what we are doing now. Now I am working with my charge nurse in my clinical unit, and she was interested in medication errors and related or factors that are associated with medication errors. So we are developing a very small proposal on retrospective chart review. It's not a major research methodology, but a simple research steps that we are going to develop in our research. So these are some of the things that, and we have research day where the institution has, the university has a research day where we are allowed to project what we do. And not only there, not only big researchers, anyone who has done a very simple research is also encouraged to project. and in their own
Thank
group.
you, Prof. Thank you. Sorry, I have to cut you in. I have to cut in now. We'll get back to you soon. Trust me.
Sure.
And thank you. It's been an amazing section. And right now I want to ask Gilles to please tell us what are the roles and how can NGO, INGO, who are involved in surgery or anesthesia, how can they help? How can they help us? You know, and have you ever seen some of these things done, having an international organization support researches led by nurses or nurses in participation with other colleagues? Over to you. You have 3 minutes, please, so that we can also give the participants opportunity to share their view.
Oh, thank you very much. Okay, I'm going to try to be very quick. Okay, for instance, I'm going to take 2 organizations. I'm going to take IFNA, International Federation of Nurse Anesthetists, and the International Council of Nurses. Okay, the International Federation of Nurse Anesthetists drafted scope of practice of nurse anesthetist 10 years ago, and they made a lobby to beside ICN so that it can publish guidelines, worldwide guidelines for the nurse anesthetist. So in 2021, we have published guidelines about the scope of practice, and the scope of practice of nurse anesthetist is based on 7 pillars. I'm going to cite them quickly. The nurse anesthetist, according to these guidelines, is an expert, is a professional, is a communicator, collaborator, leader, health advocate, and a researcher. So now research is incorporated within the scope of practice, the nurse anesthetist. So with this being said, the ICN being a member of corresponding member of the nurses toward the WHO. The WHO directs this to the ministries of health worldwide. Now the organizations, national organization, they can claim the guidelines towards their respective ministries of health to modify the scope of practice and the guidelines so that they can be incorporated on a national level, so that now these guidelines can be incorporated. This is one example. Another example that I can state, we can say, for instance, the WFSA guidelines that were published. There is a checklist that involves to make a nationwide research about capacity in the OR and anesthesia facility. Once you do that, it requires to do a nationwide research to sort out what are the requirements, the equipment needed, the personnel, and this, once it is done, it can facilitate in doing. Okay, another quick point is the short courses that are promoted both by LAFBUCS and WFSA. I'm going to state the names quickly. For instance, the SAFE course. The SAFE courses are evidence-based courses that, when implemented on a nationwide, they can allow a follow-up research for the efficacy of implementing these short courses. So yes, I can say that there's many ways to get involved into research through international organizations, but we have to be willing to make those connections and to inquire about doing the research, because it's a demanding process. Yes, I can. Thank you very much.
Thank you so much. Yes, there's a need for collaboration, for connection, and I'm sure outside ICN, we still have other organizations that will be interested in empowering nurses, especially in the area of research. Quickly, our time is fast spent. I want to call on Professor Vinitha to discuss with us in the next 2 minutes what roles could academic journals play in supporting the development of research skill among the perioperative nurses. Thank you. Over to you.
I think one thing that we observe is although enough journals are not there, especially for nursing, there are journals who, which publishes research related to perioperative nursing. One thing we need to do probably is to make sure that we list these journals which would publish perioperative nursing articles and distribute among those who are interested among the nurses. So they are aware of what are the journals that are available for showcasing their research or publishing their research. Another way that we are doing in our journal that we are publishing is that we have a research section, research methodology section. So every issue has a particular approach or something related to research in that section. An article by a well-known author who writes about something on research. So that will be useful for the nurses as well as the students and others. That is another way journals can help. And there's also a lot of encouragement to publish not only well-known researchers' article, but also researchers or studies or projects that are done at the bedside by the nurses who work at the bedside. And if they have done, to encourage publishing the articles, and also to make sure that the interventions that have been used in many of the setups have worked. And that's a way that we can share that knowledge through publication. So encouraging staff to publish, and also journals to encourage and accept these articles. That's another way of facilitating research interest as well as research knowledge and the ability to publish. These are the ways I'm thinking. Many times all journals do not do that, but if these are thought about, then it'll be very useful for nurses. Thank you.
Thank you so much, Professor Vinitha. I love the fact that you always keep it short. Thank you. Yes, friends and colleagues, thank you for staying tuned. This is the Transformational Dialogue event, improving research capacity in perioperative nursing. Fantastic. Thank you. We've heard a lot from our panelists. And just to say that, yes, it's Transformational Dialogue event, but there are key people who have been driving to see that nursing research and our voices come to limelight. And I just want to recognize the CEO of Lifebox in person of Chris Sokensing. Thank you so much. Fantastic lady who has been pushing and supporting nursing all over the world. And I also want to say a big thank you to Executive Director of G4 Alliance in person of Daniel Peterson. Thank you so much. Twale, 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 just the way we say it in Africa. So quickly to the panelists. This question goes to everyone. Anyone that wants to give it a shot to please go ahead. Yes, we know. How do we now? We have discussed so much bottlenecks in carry out researches in perioperative nursing domain. Now let's take it down to the clinical area. Considering the fact that we have very low human resource for health cut across all countries is a global problem. Now, what are the steps or measures or strategy we can still put in place just to ensure that even the clinical nurses, especially the perioperative nurses, also involved in research? Thank you. Who wants to give a shot? Austin, I'm sure you are itching to speak. Go ahead, darling. Go ahead.
Yeah, many thanks. To promote that, maybe in the long run, I think we need to
1 minute, please.
It's fine. In the long run, we need to ensure that the career ladder also includes a research, and that research is incentivized by the leaders. And secondly, the clinical nurses have the data, rich data, which academics can actually make use of. So we need that collaboration. Universities, colleges reach out to the clinical nurses, do the operations research using that data. and you know, make use of that to produce information, expand the board of knowledge of nursing. Thank you.
Thank you. Comment from Larissa. How do we improve research among our clinical nurses? Thank you.
Eu agradeço muito novamente, tem sido um aprendizado enorme estar com todos vocês.
Thank you very much again. We have learned so much. Being here is one of the greatest initiatives, learning so much about nursing research. I believe this joint effort is very important for the future. This leads us to promote research within the rooms I deal with. There is this skill to inspire people, all those within the scope of nursing that wish to improve. We cannot live alone in a nursing environment. There is the will. Where there's a will, there's a way to improve people, improving so that people can feel inspired to do research. They have to feel safe. People actually need our assistance.
Thank you so much. What can I say? It's been amazing, amazing section. However, at this point, we still want to hear from our panelists. 1 minute each. What is that biggest factor that supported you in developing your research skill in nursing? The biggest, factors that really supported you, in the journey of your career as a nurse leader. Who will go first? Gil, my darling, go ahead.
Yeah, okay. I have many ideas, but let me try to find one. Okay. The sole and important thing that I would say is like the profession was up or not directed much interest, I would say, because I'm going to be honest, I only had one when I was doing a bachelor's degree. One resource to consult for anesthesia. This was huge. So this was a great motivator to be included into research, creating the association so that we can generate even much more resources. So I would say the fact that the profession itself was like abandoned some way. So it was like my biggest motivator. I'm sticking with this one.
Thank you so much. Over to you, Professor Vinitha.
For me, it was my own clinical area. There were a lot of questions that came up. My interest area was pediatric burns, and I was involved very closely in giving care to these children with burns and their wound. And as I was giving care, there were a lot of questions that came up, which will work, which will not work. And I had to really do something, try out interventions to see whether it was working. So the research interest started from there. Not that I did all I was able to work out all the questions, but I would say it is my research, clinical area from where my questions came up. And ultimately, I was able to do something related to pediatric burns in my PhD. So I would say the clinical area was my motivation to create my research interest. And when I was able to apply what I learned and from research into my practice, that really gave me such a great satisfaction. It works, and I found that it works, and I'm able to put it back in practice. I think that is what is motivating me to continue my research.
Thank you. Thank you so much. Over to you, Austin.
Many thanks. So as for me personally, it was my mentors. I think I had one of the most wonderful mentors. So mentors usually sometimes throw you in the deep end where you really need to go further to improve your capacity. So it's my mentor who kept challenging me And also at the same time, what really motivated me was my first paper being accepted. Then I thought, so I can write something which is acceptable in the scientific community. So that positive reinforcement. So I also maybe I have a plea to editors and peer reviewers. I think they need to be kind on authors, at least to try to promote them. So that positive reinforcement is something which actually kept me going, and even for now. Yes, thank you.
Thank you so much. Larissa, go ahead. One factor that actually keep you in this race.
Eu aprendi muito
I have learned a lot. I believe my colleagues have already said a lot about what is necessary. For me, it has been so important to work with teamwork, with this vision from so many countries, so that we can lead the new generations and work in accordance, dealing with all this information. This is one of the huge challenges for those who do research. I believe in multidisciplinary work. So when we need to develop the skills of not only nurses, but all the other professionals, I really thank you for the opportunity. I have learned a lot from you all. Thank you.
Thank you so much for sharing that. Anyway, for me, I think what's really provoked my interest in research is the fact that oftentimes I've been boxed to one corner. People don't want to involve me in research. At the point I was like, what is wrong? What have I done to you guys? And it's the physician oftentimes that have this, that have the grants, that most of the time have experience in research training, travel abroad and all of that. So when they come back to the hospital and say, okay, we need to do this, you need to take this protocol. The question is, you want me to follow this protocol because we are carrying out a study like this. I want to be involved. And oftentimes they will tell you, no, sorry, it's not meant for nurses. So I was like, it's not meant for nurses, it's not meant for nurses. So that kept me thriving and thriving. And I said, look, this got to stop. You know what I'm saying? This just have to stop. And I want to say thank you. Thank you so much, Transformational Dialogue Coalition, for giving us this opportunity to share this experience. Yes, it is time right now. This discussion, this meeting is a bride and groom affair. So we now open the floor to our distinguished colleagues, partners, friends, to also make contribution. And before that, I just want to say that there are a few comments that I've gone through on the chat box, and one from Karen, who talked about the limitation of research among the registered nurses. Of course, that there's no enough emphasis. So among those registered nurses, registered midwife, oftentimes research is being downplayed as if it's not important in nursing profession. And I want to say thank you for that comment. Moriah from Nigeria, thank you so much. She also talked about the role international organizations can play in supporting. There must be an intentional step to support nursing, to carry out mentorship, as been said. I also hope that after this meeting, we can also form a coalition of mentors for nurses all over the world where we can mentor. Someone somewhere have mentors, either once or twice, but we also need to give back. We also need to mentor other people. So over to our distinguished participants. What are your thoughts in this? Comment, contribution. Just raise up your hand, and if I can't see you, I'm sure the team will be able to identify you. Okay, I could see your hand, Samuel. Kindly unmute yourself and go for it. Make it brief, please.
Hi, good evening. This is Sangeeta Samuel from CMC Ludhiana, India. So it was nice hearing to the panelists, and it was nice to see Vinitha ma'am, as she was my teacher when I was studying in Vellore. So great hearing from all the panelists. I just want to add this mentorship that you're discussing. I think we should have more mentors. As I am in the another part of the country where we have CMC Vellore in another same country, but we have a different challenges in doing research. So nowadays, I think nurses are more involved in research because physicians have their own projects, research projects going on. So many of our graduates want to join research and work as research nurses, where they are involved only in the data collection process. So I think as developing countries, we need to involve ourselves and write more proposals. And I'll be happy if we mentor each other and learn from each other. So, and another thing in our country, in India, I find that the nursing researchers, the funding agencies, and we are not aware of much of funding opportunities in India for nursing researchers. So I think we should explore that and help each other and do some evidence-based collaborative nursing researches. Thank you.
Thank you so much, Samuel, all the way from India. Thank you. Do we have any other hands? It's very important to also create awareness around funding opportunity. Thank you for sharing that. Any other person? And I could see it, our colleagues who are consultants, pediatricians, thank you so much. Thank you. We cannot do this alone. It's a teamwork. Yeah, thank you. I'm seeing you, Paul. Kindly unmute and go for it.
Thank you for this nice discussion. I do appreciate it, and it's very, 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 very wonderful. And thank you for the job you are doing, especially for encouraging the perioperative nursing. You wanted to highlight one thing you ended up where you were saying that sometimes physicians, they feel like they are the one who will be leading some quality improvement project, and at some point they think nurses doesn't have similar capacity, which is wrong. In the move now we are moving in is where we are involving everyone. And I would recommend you in the future talk like this or discussion like this, you would invite some surgeon, anesthesiologist, obstetrician, other involved perioperative staff, so that they can see the potential you are having, and then you can discuss. And these are the leaders who can implement back in the setting where they are working. That's my comment. Thank you.
Wow, thank you so much. I think that is very interesting. Again, we also don't want to work in silo, we want to work together with other colleagues. And that is noted. Thank you so much, Paul. And I see Njoku's hand up from Nigeria. Could you please unmute your mic and speak with us? Njoku, are you still there? Okay, so do we have any other person that wants to share one or two thoughts? Okay, so I see your hands up. Muriah, I'll come back to you, Tosin. Thank you.
Good afternoon, world leaders, nurses. Good afternoon. Thank you for this wonderful presentations. Thank you to the panelists. Very insightful topic we have been having on research, building capacity for nurses. One contribution I would love to make, and which I have been putting in the chat room, has to do with mentorship. You know, there's one thing for nurses to want to do research. There's another thing for nurses not to know how to go about it. In as much as we've had background knowledge about research in our undergraduates and the rest of the things, but let's come to reality. I heard two of the panelists talking about evidence-based practice. The nurses who are on the ward, who cares for these patients, who cares for the clients on the ward, we are the ones with data. And if you look at it, we are the ones that don't even have the clue about how to go about research. Not every nurse caring for patients on the ward have a clue, because their attention is basically focused on ensuring that they give holistic care to the patient. But if we allow ourselves to work the knowledge, to build knowledge, to have mentors, real-time mentors who are really willing to help nurses grow, to help us build capacity in times of research, a lot of nurses will be out there. I, for one, in fact, I have been saying I really want to do research. But how to go about it? Who are the mentors that will be willing to hold your hands and see that you actualize what you really desire to do? So mentorship for nursing in research is what we should not toil with. Again, grants, funding. I heard the Associate Prof, Augustine, talking about funding, fellowship grants. We need people, we need organizations. Yes, we know we have some, but how do we access it? So expertise shouldn't be what we joke with. So in a nutshell, I think that mentoring is good to build capacity for those who are interested in research. Grants opportunities should be given to those who have already started. So I think this is just my little contribution towards today's event. Thank you all.
Thank you so much, Murayo. Quickly, Tosin Fatoba. Tosin, please unmute. Thank you.
All right, thank you. Thank you for this great presentation, and thank you for the organizer of this event. I just want to ask, looking at the situation of the country, of our workplace and the country presently, I want to ask the involvement of the Nursing and Midwifery Council of Nigeria in building the capacity of nurses in research, because what we know, even the organization, even the council, the organization, the only thing we hear is licensing and all those things. But the major thing concerning research, I think they are not really doing more in building the capacity. And again, in perioperative nursing, generally, we notice kind of a lot of short staffing, and this is also affecting things. It's also affecting research work. So I don't know how the government, the Nursing and Midwifery Council can assist in helping perioperative nurses. You can see that if you look at globally, more than 10 million surgeries is being done every year, and it's only 40,000 perioperative nurses that is attached to do this number of surgeries, and couple it with doing research. So I don't know this challenge. How can we solve it, and how can our leaders assist us in building a capacity and interest in research? Thank you.
Thank you so much, Tosin. Anyway, we did not invite the council members to join this meeting, and I can assure you in the next episode of this meeting, we'll ensure that we invite some council members to do. However, in Nigeria, I know that which have participated, that Nursing and Midwifery Council organize research training. However, many people might not know, but because the criteria was, they were looking for nurses who are involved in research with evidence. So if you don't have ethical approval of any research, the council will not invite you for that meeting. It was on that level I was invited. So that is what I can say. But in the next meeting, God's willing, and we'll invite one or two council members from other countries to share their plan and what they are doing. Right now, as we are rounding up this section, I want to call on Dr. Funke. Dr. Funke is actually a pediatrician from Nigeria who love nurses a lot. We've been working together, and I'm seeing your comment on subspecialty. But if you are still online, please on mic, unmute your mic and speak to us directly. We want to hear your view. Dr. Funke, are you there? Okay, so I think, okay, Dr. Olufunke Bolaji, go
Hello,
ahead.
Can you hear me?
Yes,
Hello?
we can hear you. Yeah, go
All
ahead.
right, it's good to be here. Thank you so much for the wonderful session. And I think everything that can be done to facilitate research among nurses should actually be done. We can never have too much of research. And it's important that from every angle where we have breakthroughs in research from nurses, from doctors, and more importantly, from my perspective, there should be collaboration in research, even between physicians and nurses. That's very important. And I was making the point about subspecialization. Not that we should all subspecialize, but because someone is looking at keeping, you have nurses that have worked with keeping, you have doctors that have worked with keeping, you can make up a team and publish something on it and access grants and access scholarships. So that's my point about subspecialization, which I think can really come in handy. Thank you so much. Well done to everybody. Thank you.
Thank you so much. We really appreciate your time. Thank you. Thank you. And that is one good thing that I've come to realize about Livebox, promoting teamwork. I think their second name is Teamwork. So if I mention teamwork, just know that I'm referring to Livebox. And we cannot overemphasize the fact that we need to work as a team to also conduct quality research. Now on the final ground, I want the panelists to please give us their final points, as we round up. I want to start with my friend, Gilles. Please give a short 1 minute and goes round like that. Thank you.
Oh, 1 minute. Okay, I'm going to try to summarize what I have to say. So, okay, I'm going to be specific about French-speaking countries, about the conception of nursing specifically. So somehow nursing is felt to be like, in some sense, like a third wheel to the physician ward, as not a profession apart. Because I'm going to take the context of Burundi. Sometimes the nurses are confused with ad hoc trained professionals, paramedics, and nurses. The ad hoc trained on the ground, the paramedics on the level of high school, and nurses at a university level, academic level. So sometimes it is confused, and the general public is also confused. For instance, in Burundi, and I guess in Rwanda, there's no name in our mother tongue to say nurse, but we have in English, nurse comes from nurture. In French, it is infirmier. It's about those handicapped. In Swahili, we can define nurse, the one who accompanies the ill, but in our mother tongues, we don't have a word that specifically deals with nursing. So it is not properly defined, so that we are confused about what is nursing. So what my final word is, if we had to value going to the roots of nursing and try to categorize the different fields that deal with the patients, the physician ward and the non-physician ward, because in many African countries, where Francophone countries, they say physicians and paramedics, the remaining is paramedics, but this is wrong to do that, because nurses, paramedics, ad hoc trained, and all other fields are very different. So if we can look into the nursing profession, we can find beautiful things inside. And the research is one branch of what we can take on and expand. So time is very short. I can't explain more, but this is my final take.
Thank you so much. That is awesome. Right now I want to call on Larissa. Go ahead, darling.
Larissa, over to you.
Okay. So while we are waiting for Larissa, Austin, go for it. Your final word, please.
Thank you very much. So my final word is we have resources in place already. Yeah, like we have mentors. Actually, they are looking for people, for mentees to mentor. We have the data, is in the clinical area. We have the cases in the clinical area. Things are there, things are in place. I'll give an example. In 2015 in Rwanda, actually we speak a lot of languages. That's one of our talents. So we also speak a lot of French. In 2015, we did a conference. It was called the Global Innovation of Nursing and Midwifery Education Research and Practice. From that one alone actually came 6 published articles and 40 presentations in that one. So it also actually speaks to the role of the nurses associations in actually trying to promote that research. So we have the resources, they are there, the articles are there. So it's an issue of just promoting the resources that we have, and also promoting collaborations. I know research is not something that you can learn from class. You say after a bachelor's degree or master's degree that I am now a seasoned researcher. There are many other extra courses that you may need to do. So with that mentorship and also maybe using the resources that we have, we can promote that research and also reach out to other professionals. I know the other health professions also may share the same challenges. They also need mentors and these collaborations. Thank you. Thank you.
Thank you very much, Austin. Over to you, Larissa. Can we hear you now? Thank you.
Sim.
Yes.
Agradecer a oportunidade.
I would like to thank the opportunity that we are all here. It was a moment of great learning. I reinforced it's important to be together to promote the research in nursing. It will be very hard to carry on by himself. I'm sorry, there's someone else talking, so I can't really hear her. I would like to put myself available. I would like to make myself available. I thank you the opportunity. I am at your disposal so we can together take research and nursing and this main character of the healthcare in the world.
Wow, amazing. I'm so excited to know that, yes, we can count on you. Thank you. Over to you, my teacher, Professor Vinitha.
Yeah, Bunny, I love what Larissa said. I am available. I am there. You can, no, we can do together. I think that's the best finish. I think it depends on us, nurses. Nobody is preventing us from doing research. Nobody is preventing us from publishing. So it is in us. We have to make sure that we are empowered. We get help if it is necessary, and we move forward. And that's what we should be thinking of. And when we do it, we become better. Until even just learning is not enough. We have to do it. So we become better. And when we become better, we automatically are involved in collaborative researches. And we learn more, we become better and better. And when we become better in research, our patient care, it depends on it all about patient outcomes. Our patient outcomes become better. So naturally, our perioperative nursing becomes better. So that's what I would like to say. So let us take this and move forward and do whatever we can. Thank you.
Thank you so much, Prof. Yes, everything depends on us. It just has to start with us. Thank you so much. And I'm also happy that you say you are available so we can come running after you. Thank you, Prof. So right now we want to hear from a representative of Transformation Dialogue Coalition, and it is my humble honor to call on the Executive Director, G4 Alliance, in person of Daniel Peterson. Who wants your comment, please? Over to you, Dan.
Thanks, Budmi, and I'm just so excited about all that we've heard from these stories and these experiences that people are bringing to us here, and being able to learn from each other's experiences. That's what we're trying to do. That's what the G4 Alliance is all about, and we're so proud to be part of this experience of transformational dialogues. And if people would like to get more involved in the G4 Alliance, just put your email in the chat. I'd be happy to send you an invite to our monthly meetings. We meet on Zoom every month, and we can talk about exchanging ideas some more. So if you'd like to join us, please just put your email in the chat and I'll send you a calendar invite. But I'm so pleased to see this organized today, and I learned a great deal from everyone today.
Wow, thank you so much. And on the final notes, you know, in Nigeria, we have a proverb that says the biggest masquerade is the one that dances last. So it is with all humility, I call on my boss, the CEO of Lifebox. Over to you, Chris.
Hi, everybody. It's an honor to be part of this. I learned so much today, and I think that nursing-centered research in the perioperative setting is the future of how we're going to learn and create the kind of teamwork that has real impact on patient safety, which is, as somebody said, is the most important objective. So more power to you all, and we'll be here from Lifebox, and I know the other organizations participating in transformational dialogue see this as just a step on the pathway to more and more investment in nursing and perioperative nursing research. Thank you all.
Thank you so much. We are so grateful for all your support for nurses globally. And yes, we have our website on the chat box. Kindly pick it up. And finally, I want to say a very big thank you. Big thank you to the audience. You are the reason why we are here. Without you, the panelists will not be here. So we are so grateful. Thank you so much. Thank you so much. Tuali, thank you. And I want to say thank you to all the distinguished panelists. Oh my God, what can we do without you? Thank you for sharing your experiences. Thank you for showing us the path to go. And trust me, we will not deviate from the path. And I want to say special thank you to those behind the scene that makes this happen. Thank you so much, Kitty. Thank you, the team. Thank you so much. I don't even know what to say. I just want to say thank you for your time, for sacrifices. And of course, the final appreciation goes to Transformational Dialogue and for supporting us, for finding it worthy to say, yes, nursing research must be on the limelight, must be on the table. Thank you. And next week, we are going to have Transformational Dialogue meeting. Please take your time to join us and we'll move from here. So the final notes, I would just want to say thank you. Thank you so much. You can unmute your mic and just say thank you as we close this section.
Thank you.
Thank you so much.
Thank you.
Thank you,
so
Christine.
much.
Thank
That's
you.
amazing.
Thank you, Dan.